Hello, and welcome to this episode of In Discussion With from Medical Update Online. Today I'm talking to Birgit Tans and Paul Sessink about safe handling of hazardous medicinal products, in particular what the guidance says and how this is translated into practice. Could you start by introducing yourselves?
My name is Paul Sessink. I'm a chemist from original start amid my studies. And later on, I started with a PhD study sponsored by the Ministry of Social Affairs in the Netherlands on hazardous drug exposure. And I got that PhD in 1996. And later on, I started my company Exposure Control based on all the studies we have done. And that company is still running, and we do a lot of monitoring around the globe for hazardous drug exposure.
Okay, my name is Birgit Tans. I'm a hospital pharmacist in the University Hospitals of Leuven in Belgium. I worked there for 37 years now, from whom about 30 years I'm responsible for the toxic products and especially in the compounding material and also everything that has to do with spillage and safe handling.
And can you each give us a brief overview of your role, what your current job involves?
We do already many years monitoring studies in hospitals, mainly to check exposure or contamination. And that's based on surface wipe testing. We have a kit to check the environment, whether or not there is contamination. We send it to the customers, to the hospitals. They do the checks themselves, and we send the samples to our laboratory in the Netherlands, where we do the analysis, and then I make a report with results and recommendations. And we have done this already in about 350 hospitals in the world over the last years. So that's the main thing we are doing. And nowadays, or at least recently, we changed also to add antibiotics to this group of drugs. So it's not only the hazardous drugs, but also the antibiotics, because we consider that a lot of exposure is happening with antibiotics, and people really get upset because they think they can be sensitized to these antibiotics. And so that's another topic we are focusing on. So that's what we offer customers, and we do actually the analysis. We explain the results and we give the recommendations to improve their safety.
I am part of the compounding team of our hospital. This means semi-industrial preparations and also for patients preparations. But my specialism is the cytotoxics and other potent or hazardous drugs, especially then the compounding part and also everything that is involved in safe handling and spillage and other things that has to do with hazardous drugs.
Now, you ran a joint workshop at the JERPAC Congress on safe handling of hazardous medicinal products, and this is what I'd like to focus on in this interview. But my first question is, what are we talking about here? What is a hazardous medicinal product?
Well, it's very strict described what it is, and it's also the guidance is really focusing on HMPs, hazardous medicinal products. That means that all drugs that are either carcinogenic, either mutagenic, or either reprotoxic are HMPs, hazardous medicinal products. So it should not be all the three parts of it, not all three, but if one of the three is available, then it's considered as a hazardous medicinal product.
Mm-hmm. And why is the handling of these products an issue?
That's a good question, and it was also what I asked myself. The issue is that there are many European countries who have already their guidelines on safety when you handle hazardous drugs. But not all the countries are on the same level. There are big differences between member states, and there is a growing concern that I would say there are about 3-4 million people working with these drugs daily, that this could have an adverse effect on their health on the long term. And so there was a need for a European view on guidance, which would enable countries who are a little bit back to progress, to make steps forward, and to come at a certain level where we would say, well, this is a good practice level. And because there are so many studies published how to do this and so on, and different ways, different approaches, there was a real need, said by the people who work with these drugs. We would like to have a guidance document that helps us making steps forward. So finally, the European Commission agreed after many years to have this guidance document. And this guidance document actually shows the need that people get aware of the risks when they are handling hazardous drugs and how to manage and control when they handle the drugs. So they give recommendations, they give advice how to proceed when you are daily working with these drugs. And that means not only from pharmacy side where you have the preparation, but it's also nursing when it is about administration. And then, of course, you have the waste, the cleaning, and all these other jobs that are related to potential exposure to hazardous drugs. So that was actually the basic behind the guidance, and it ended up in a big book, which is, it's not easy to read, I must say, but there is a first step in the guidance which showed that if you go to that table, it is showing you which sections of the guidance is relevant for your job. For instance, when you are a pharmacist, you have to read maybe 4 or 5 sections of the whole guidance which are relevant for you. So it's very helpful to use and to apply in daily practice.
I see. But how can I tell if a medicinal product is hazardous? Where would I find the information?
There is information available nowadays. For instance, in the United States, you have the NIOSH document, which lists a lot of drugs that are hazardous to people, to workers. There are also within Europe lists in several countries. So there is already information available on paper, but also there are data files where you can find this information. So if you want to know if a certain drug is hazardous, then you can find it there. But there are, of course, drugs who are not on the lists, and that makes that you have always to be aware that there is a potential risk for these drugs to be dangerous, hazardous for you. For example, we have to deal with investigational drugs that are not on the market, but are used in clinical trials, who can be very dangerous. So there is always a lot of information available, and if it's not there, then the producer of the hazardous drug should provide you with that document. So you can find it, but it's mostly not so easy to find the drugs that are not so frequently used. So that's more complicated. But there are list databases available.
You've already mentioned the European Commission guidance on handling of hazardous medicinal products. Can you tell us a bit more about this?
You should see the guidance as a guidance document. It guides you through the issue. It guides you through the issue of potential exposure to hazardous drugs. It's not a law. So that means that all what is written in the guidance is not a law, but parts of the guidance are already law within Europe. There is, for instance, the obligation for the employer to give information to the employee who is working with these hazardous drugs. They have to provide you information how to handle it, how to manage it, and they are also obliged to give you training and education when you have to handle these drugs. So there is already quite a lot of law within the guidance which is available. But the practical things are mostly based on experience from people who are working with these hazardous drugs. For instance, the pharmacy technicians, when it comes to compounding preparation, they have a lot of experience. So a lot of good practice from the member states are within that guidance document. So if you read that chapter and you want to have more information about it, you just pick out the things that are relevant for you and you can check, does this meet my standard of practice I have nowadays? Are there issues to improve? That's, for instance, pharmacy. Then you have, of course, the nursing, which is the administration step. There is a lot of exposure. We know it from testing, from all kinds of studies done, that actually the nurses are the biggest group that are exposed to these hazardous drugs. So a lot of, I would say, precautions and measures should be focused on the nursing part. But there are good examples how you can improve conditions, working conditions, and safety for nurses within the guidance document. So, and then you have all the parts which are relevant, which are obliged actually by law. That's, for instance, that employers should provide and do a risk assessment of the drugs that are handled. Of course, a director of a hospital will not do it himself, but he has to appoint people showing, well, within our organization, there have to be people who do this job because it's obliged, and it's the management of a hospital who has to responsible to check for this. Then there are other parts in the guidance which have to be done. That's a monitoring process. If you do a risk assessment, you have to do also an exposure assessment, which is also obliged. And you see that these two parts, risk assessment and exposure assessment, is not done in hospitals nowadays. It's most hospitals don't do it, but they have to do it. So that's an obliged part within the guidance document. Then you have the other steps which are in the guidance, which is, for instance, veterinary sector. We have to deal with waste management. We have to deal with cleaning, all these kind of people. So all these sectors are within the guidance document. So, and it gives all kind of recommendations, advices how to handle potential exposure and risk within their sectors. Within the whole chain, the whole supply chain, from actually production till the end waste management.
So what are the key steps?
Well, the key steps is first start with identifying the hazardous medicinal products, the hazardous drugs. And that's what should be done to get a start first. And that's what I said, the responsibility of the employer to get that done. And with help, of course, with other people who are, really a specialist in this field. The second step, which is also obliged, is the risk assessment. You have to do a risk assessment when you are handling these hazardous drugs, which is also responsible of the employer. And the work should be done also by specialists. Then the third thing I would like to stress is the monitoring. The exposure, because when you know the exposure, then you can decide based on these results, are additional steps needed and where should we focus on. And that part is also obliged by law, so it's the responsibility of the employer to get that organized too. Of course, done by specialists in the field. So I would say these three are the main issues, and you have to do that frequently. You have to update it and so on. So it's a continuous process to be done.
Clearly, there's a lot of technical knowledge required to carry out this kind of work. Now, assuming that pharmacists and technicians already have their basic training, my question is, what kind of additional training is required?
I think in most cases that will be a part already on the basic education before you get started with handling these drugs. But as soon as you start, you should get education and training continuously. And we see often that people get trained when they start, and because sometimes you need kind of approval to get started when you handle these drugs. But then it stops. That's the only training they got, and that's it. And then you see also that by the routines they have, they do the work daily and they just continue what they are doing. And they are mostly not so critical. So they think what we are doing is fine and it's an ever-going process and there is no reason to worry about. But that's not the case. In practical, it's like there is an evolution, there is a process going on. There are new drugs coming. There are other issues in terms of the devices using the end products, syringes, bags, they change cassettes and whatever. So actually the training is a continuous process. So they should be done at the start with the basics, so you get approved to do it, but then it should be repeated once a year or once in 2 years or whatever. But it should be a continuous process to make people, and that's really irrelevant, to make them continuously aware about the potential risk of being exposed. And when you do work for many years, then sometimes you forget things, or you're not worried and so on. But the continuous education is really relevant to have that awareness going on continuously. So that's really important. And it's, of course, the responsibility, again, for the employer to get that done. So you have to be trained, educated continuously, paid by the employer, and it should be offered during work time. So you need not to come for a free evening or free weekend to do this training. It should be offered during your working time. And that's also set or ruled by law. So it's nothing new, but it's practically mostly not done.
Can we explore monitoring of exposure to hazardous drugs in more detail? How is it done? And how do you know if people are exposed to unacceptable levels?
That's a complicated question, but I will try to answer it, because this part is often not done in hospitals. And the reason I think why it's not done is probably that it's rather complicated to do and to explain the results and how to interpret the results and follow up. There are actually two main issues that are relevant when people are handling hazardous drugs, and we focus on pharmacy, we focus a little bit on nursing, so within the hospital, the main group. There we have to deal with two exposure routes that are relevant. The first one is that you inhale the drugs, you get it in your body by inhalation, nose and mouth. That's one point. And the second is that you get it on your skin. For instance, you have it on your hands, you get in contact with the drug by contaminated surfaces. These are the two main issues. Well, the air sampling is only relevant when you deal with powders or things like that, which are not so frequently used in hospitals. It's mainly when for special preparations or products or whatever is needed, then you need some powders to handle. But mainly it's hospitals that pharmacy that deal with vials, which are encapsulated drugs, and from that you do the preparation, do the compounding to set up an administration product that can be a syringe, that can be an infusion bag, that can be an infusion pump like this. And in that process, the main risk, the most important risk, is getting in contact with contaminated surfaces. That can be in a cabinet, that can be on a bench, that can be on products, whatever. So everything you can touch can be contaminated and you can get in contact with it. So the exposure risk is there. So that's the reason why you have always to wear gloves, protective gloves, to avoid any contact with contamination on surfaces, to get it on your hands, because when it's on your hands, it can get into your body and then you are exposed. So for that check, we and a lot of others do the surface wipe sampling, because the surface wipe sampling is showing that you have drugs on surfaces in the environment, which can finally end up in exposure of the workers. So these wipe testing they're quite simple to do. It's just you swap a surface with a liquid and then you have a sample. And you send that sample, you send to a laboratory, and then they analyze how much drug is in it, and you can correct it on the surface area you have sampled. So you get a contamination on a square centimeter or square inch or whatever you want. That gives you some information, so you can find high levels or low levels or moderate levels. And then you get the problem how to interpret this.
So how do you tackle the issue of interpretation?
We ourselves do it very practically. We have a kind of a traffic light model, which we have introduced years ago. And it said below a certain level, we call it green, and above a certain level, we call it red, and in between it's yellow and orange. And that means that gives you an impression how to handle the contamination issue. Unfortunately, there is no threshold limit saying you should be below this, or you cannot be, it's not allowed to be above a certain level. But it gives you a first impression about the contamination and your working conditions. If it's all low or not detectable, you have a good working procedure, all is fine. When it's high, then there are probably spills and leakage, and you can, according to the results, you can make changes in your process or in the devices you are using.
That's very useful. Now, one of the things that you mentioned in the workshop was having safe systems of working. What kinds of things does this cover?
Just give some examples for pharmacy, for compounding. I think most relevant is with all these issues on hazardous drugs is that you prevent exposure. Prevent that drugs get in the environment and prevent that people get exposed. So prevention is the first step. And because if you don't prevent and you cause the problem, you have the problem that should be solved. So then you have a lot of extra work to do to get rid of the problem. So if you can prevent that there is a problem, you are on the right way. When I look in compounding and preparation in hospital pharmacies, of course, they have the clean room facility, which is well organized. They have a safety cabinet, they have an isolator. It's all the technical things are in place. But finally, it's the work of the technicians, the pharmacy technicians, that it's not like a robot. They work manually and people make mistakes. And we see within these cabinets and within these isolators that there are spills, there are leakage. You don't see it, but they are there, because when we do the surface wipe testing in an isolator or in a cabinet, we see spills of drugs there. The point is, as long as it stays inside and not getting out on a product like an infusion bag or a syringe or whatever, then it's fine. But there is never a guarantee that it's clean when it's leaving the pharmacy and going to nursing. So to avoid all these problems or potential problems, the way to solve this is using closed system transfer devices. It's a kind of a technique where you transfer the drug from a vial, which is the primary packaging, to the end product that you're preparing. If you have that process closed, and there is no spill or leakage, you will not have a contaminated product and you will not spread the contamination. So I would say 90–95% of the problem can be solved there. Then there is the remaining issue, and most pharmacists, they talk about it. They say, well, we get the drugs in these vials, and these vials are mostly not clean on the outside. So when we have these vials coming in and they are contaminated, we start already with the contamination and spread it. So the second recommendation, and I think relevant, is try to buy clean vials. So try to get vials that are clean from the outside and guaranteed by the pharmaceutical industry. So if you cover that clean vial issue and you cover the potential leakage by using CSTDs, almost the whole issue of contamination, aside from accidents, because they can always happen, aside from accidents, the normal process can be 100% controlled.
Mm-hmm. And could I ask you, Birgit, what kinds of safe systems do you have in real life in your hospital?
So we have engineering controls. You work at this moment in BSc. Our people have also PPEs to wear, like a gown, glove, other PPE. And then we also work with CSTDs to prepare them, so to avoid needles for like needle stick injuries. And besides of that, we have a lot of procedures for how to work with these. And we also do some education and training on people that work with us.
Oh, could you just remind us, what is a BSC and what is a CSTD?
BSC is a biohazard safety cabinet, so it avoids that your workers are coming in contact with the products they work with. It's a safe environment to work in. And the CSTDs, that are closed system transfer devices. So it means that you have a device that you put on the vial with your drug, and also one on the syringe, which you will use to take your liquid out of your vial. And it's all working without needles, so it's really safe. It also avoids aerosols to be spread in the environment. So it makes it like a closed system to work with these products.
Now I'd like to turn to practical implementation and look at how hazardous medicinal products are prepared and issued in practice. So could you just walk us through the process of receiving a prescription, preparing and issuing the injection?
First of all, we get the prescription on an electronic way. From the moment the supervisor prescribes it or he validates the prescription, we get it on our computer in the pharmacy. Then we print the prescription together with the label, so we don't make errors with the transduction of the prescription to the label. Then everything that has to be used in the preparation is put together, so only one preparation at a time. We give it to our people that work in clean rooms in this biosafety cabinets, and they prepare it with the closed system transfer device. After preparation, it comes out of the unit. It's already packed in a sealed bag. So then a pharmacist will do a final control. So he will check if everything is prepared in the right way with the right products, the right doses made. And we put also a label with a yellow hand, which is a warning sign that it's an hazardous drug. In this case, also all labels of these preparations are in yellow. They are not white labels, but they are all yellow. So it also indicates that this is a hazardous drug. All the other preparations in our pharmacy get white labels, or for the or some of them red labels, but for the hazardous drugs, it's always yellow. Then it's delivered to the ward or we do it with a pneumatic tube system for our day care hospitals and some other wards that are on a long distance of the pharmacy. For the other ones, it goes with a transport tour in closed boxes, which are also leak-proof. So as I already told, the infusion is also packed in a leak-proof bag. And it also contains a barcode, the label. So when we release it in the pharmacy or when it's given to the patient, everything is scanned so we can follow the whole trajectory of this preparation throughout its from the prescription to its given to the patient. And we also have some procedures for cleaning after we prepared all these things in our cabinets, and also what to do in case of a spill.
Could I just check? Did you say that compounded products are packed in a sealed bag before it is sent to a ward?
Yes. We make the preparation, and it's the same for like injections, but also if we have to make tablets or syrups with hazardous drugs. So we pack it like in a fusion bag or maybe in a box, even its capsules. And this one is put in an over package, which is a plastic bag, and that's sealed. So if something should happen during transport, like for instance a bag that breaks, then the content, so the fluid that comes out of the bag, stays in the outer package, so nothing comes out, and we avoid spillage throughout the transport system.
That's very helpful. And now could I ask you both to give us a few tips for success? a few key points that you'd like to emphasize?
It's not so easy, but I will give a few. Let us focus on the pharmacy and compounding and preparation, a little bit on the nursing side too, because the most risks are at nursing side. I would give the following tips. I would always say never disconnect a system. If you work with a system with a needle, with a vial or with an infusion bag in compounding preparation, or when you have to give an infusion at nursing, never disconnect any system where drugs have been in. So leave it as it is. And that means also indirect that you have to use a closed system drug transfer device for compounding preparation and for administration, but also in the end, when it's disconnected, the infusion set or whatever, even if it's flushed by saline, if you disconnect it from the patient, then you have the waste issue. And when you can that handle closed, then there is also less risk for the waste management people and for the cleaning staff. So you can control the whole chain. That's what I think. Never disconnect and use a CSTD. That's really, really important. The second thing I would say is probably that training and education. It makes people continuously aware of the potential risk of being exposed and learn from each other, meet each other in your own profession and learn from hospital to another hospital, how people do things. That can be within a country, that can be within Europe. So there are several very good practices where people can learn from by meeting each other, by training, education, and going to conferences.
Yes, there are some small things where you can look at, like for instance, if you can choose between ampoules and vials for your product, don't choose ampoules because you have some possibility to cut yourself or to have glass particles in your preparation. Also, for the vials themselves, choose for sleeved vials. So if something drops and the vial breaks, the product will stay contained into the sleeve and it won't spread that much as when you don't have sleeved vials. Also for the syringes, use luer lock syringes instead of luer syringes. Then your CSTD, or if you have to use needles, is locked tight to your syringe, so that's much better. Also, when you have to prepare an infusion bag with a hazardous drug, first spike the bag and fill the line with your saline or glucose, and then after that you add the drug into the bag. So when the nurse has to connect it to the patient and she spills some drops, at the moment she wants to connect the infusion line, it's not containing hazardous drugs. So you avoid spreading contamination on the ward. If you end your preparation, all the material, we put it together in a plastic bag, and this plastic bag we close, and then we put it in the hazardous waste bin. So we avoid having some aerosols or other contamination in the environment, because these bins are open for all the day. And we also use a lot of alcohol, especially with our sterile preparations, and this could just evaporate in the environment. So that's why we contain everything first in a plastic bag and then we put it in the bin.
From what you've said so far, it seems that all the angles are covered. Does anything ever go wrong?
Unfortunately, yes. We're working with people and people can do something wrong. So all the procedures are there. But sometimes somebody forgets something, or like I said, this over package, that's really a closed bag where we put the drugs in, but sometimes they don't seal it right. And if then your bag should fall or your package falls and your infusion bag breaks, then you can have a spillage. If the seal isn't done right, you can have a spillage. So yes, things can go wrong. Unfortunately, it happens, but not too much.
I wonder, could you describe an incident from your own experience?
Yes, I can. As I told you before, we have procedure for every thing that's involved with hazardous drug preparations. But like last year, we had one incident and we had to add 190 milliliters of cisplatin in a bag of 1 liter, and our assistant didn't take the 200 ml that was too much in the bag out of the bag before adding the cisplatin, so it became a very big bag. But because the patients need a lot of fluid with cisplatin, the doctor didn't mind, and he said, you can deliver it like that, we'll give it in 1200 milliliters. So our pharmacist who did the release, he had to pack it and seal the over package. But because it's also, it has to be protected from light, we put a yellow or an orange bag over the infusion bag to protect it from light, and then it goes into the over package. But in this case, the light protecting bag was sealed together with the other bag, and this was a too thick layer of plastic, so the seal wasn't right. And then because it was quite an urgent product, the nurse came herself to get it in the pharmacy. It wasn't transported with the transport boxes that we normally do, so she took it in her hands together with some other medications, and when she left the pharmacy, this bag fell out of the outer package because the seal wasn't good, and it fell on the ground just outside the front door of our pharmacy, and the bag was broken, and it was a very big, large spill of over 1 liter. At that moment, they warned us, so myself and one of my colleagues went out of the pharmacy to clean it up with our spill box that we have for these cases. But like it was very big spill, it was not enough material inside the box, so we asks for another colleague to bring us some extra materials. But because it happened outside the pharmacy, it was in a corridor where it's a lot of traffic, and it was also lunchtime, so a lot of people were passing by. It was very difficult to get everybody out of the contaminated area. We contacted also the cleaning facility of the hospital, but it took about 2 hours before they came and cleaned everything. So in all this time, we had to just try ourselves by avoiding people to walk through that. It was very difficult because it's also the main entrance of the pharmacy, so a lot of people have to come there, and it's also a way where a lot of other people pass to go to their wards or the cafeteria or other things. So we learned a lot out of this case, and we took some arrangements to avoid that it happens again, and we also have some revised some procedures to do it better when it should happen again. So we have, like, for instance, a back entrance of the pharmacy. We can make a detour and let people go in there, so it's easier to block the way where happened a big spill. So we learned a lot of things out of that, but unfortunately it still happens despite all the procedures we have.
And do you have any closing messages for pharmacists and other frontline healthcare workers?
I would recommend people to take the guidance document, the European guidance document, which is unfortunately only available now in English, but it will be translated to all member states, countries. So it will be in all languages. And well, the Commission promised to have it done soon, but it takes always more time than we hope for. But it will come in many languages. I would people recommend read that document and go to the table which is relevant for your profession. So you need not to read the whole document, but just take the sections that are relevant, which are mostly 3, 4, 5 sections out of the whole document. Take them, put them aside of your work process you have now today, and just compare and see if you can make some improvements. And if you think there are parts in it that are better, try to implement them. and follow up. And in that way, you come to a level of good practice. That's why I say it's not best practice, but it's good practice. It's good standard practice. That should be done together with the risk assessment and the exposure assessment, because it's a combination. Because what you do, you change your process and you have to validate, has it improved or not? Otherwise, it doesn't make sense. So that means that you have to do some kind of monitoring exposure assessment. Based on the results, you can decide whether or not to do it frequently, how often, can be 6 months, once a year, once in 2 years. But anyhow, that process, and do that together with your risk assessment. If you put it in that way, I think you have a very good and easy start of improving of the working conditions related to hazardous drug exposure. So that's what I would recommend.
First of all, you have to be aware that you work with hazardous drugs. Then a good training and education of your personnel is also very important, so that people know what they're doing. And then make sure you have the right materials and the right procedures to work with, and train your people like every year, or that's a lot, maybe every 3 years, do just a retraining to make sure they get everything, and also to explain if you have some new materials or new procedures that you want to use. And in case of a spill, stay calm.
Birgit Tans and Paul Sessink, thank you very much for talking to us about this important topic. That has been terrifically interesting and very thought-provoking. For more information about the work described in this interview, please visit the website using the links in the description. And please subscribe for more news, videos, journals, and podcasts. For updates straight to your inbox, please follow the links below. And thanks for watching.